With so much of our health information going digital and all these systems starting to talk to each other, it really brings up a fundamental question for everyone, doesn't it? Who actually gets to see our sensitive health data? It's only natural to wonder, I think, in this digital age, how private does our health history really stay?
That really is the core concern, isn't it? And it's exactly what we want to dive into today. We're looking at why your permission, your specific data consent is just so vital in this evolving landscape of digital health records. And we'll be focusing specifically on how this works with ABHA and the digital health setup in India.
Right. And maybe to sort of tackle that big privacy worry straight off the bat, it's important to state up front that this digital health framework, the one we're discussing, it's really built with patient control right at the center.
Absolutely. The ADHA, that's the Ayushman Bharat Health Account, it acts more like a gateway for sharing your health data securely, but crucially, only when you consent. So let's dig into that. How does this control actually, work in practice?
Okay, yeah, let's tackle that first big question then. If I have an ABHA number, does that mean any doctor, any hospital I walk into can just automatically pull up all my linked health records?
No, absolutely not. The sources we've looked at are very, very clear here. Healthcare providers, they can't just automatically access your linked records simply because you possess an ABHA number. They need your explicit permission first. It's definitely not an open door.
Okay, well, that's reassuring to hear. So say I'm with a doctor and they need to see some of my history. What happens then? How do I actually give that permission?
So the key thing is, it's you, the patient, who has to initiate the sharing. You decide to share your records with other healthcare providers in the network. It doesn't just happen. It only happens after you've actively, knowingly given your consent for that specific share. Your digital health info isn't shared without you saying okay.
Right, okay. So I drive it. But when I say yes, is it sort of an all or nothing thing? Like, do they suddenly get access to every single record linked to my ABHA?
That's where this idea of granular consent comes in. And it's really important. The consent you give digitally, it isn't just a blanket yes for everything. You actually have the ability to pick and choose, to share only specific health records, whichever ones are relevant for that particular appointment or that health issue.
Granular consent. Interesting.
Yeah, it gives you much finer control. It acknowledges that, sharing health data isn't always simple. Of course, it does mean you need to be aware and manage those permissions too.
Okay, granular. So I can choose what to share. Can you give me like a practical example? How would that work day to day?
Sure. Let's say you're going to see an eye specialist, right?
Right.
For maybe some blurry vision you started having. With granular consent, you could choose to share only the records related to your eye health. Things like past eye exams, maybe a diagnosis, treatments you've had for your eyes. But you could specifically choose not to share, say, records from when you saw physio about your knee injury last year. Completely unrelated.
Okay, I see.
The system's designed to offer that level of precision, so only relevant information is shared for that specific consultation.
That makes a lot of sense. So I'm making sure the doctor sees what they need, but without, opening up my entire medical history unnecessarily. Why is having that specific feature, that granular control, so important for patients?
Well, it fundamentally changes the balance of power, doesn't it? It really puts you in control of your own health story. Think about seeing a totally new doctor. Maybe you moved, or you're getting a second opinion somewhere else. Instead of trying to remember every detail, which, let's face it, can be hard.
Yeah, impossible sometimes.
Exactly. Or digging out old paper files, if you even have them. You can, give that new provider secure digital access just to the specific records they actually need. It helps them understand your situation quickly and hopefully give better care.
So the ABHA number itself, it's more like a connector, linking my records across different places. But it's not the key that opens the door.
That's a great way to think about it, yeah. The ADHA number is that unique ID. It lets the system know that records from Hospital A and Clinic B belong to the same person you. But, and this is the crucial bet to that, the number itself doesn't grant any access. Zero. Your explicit consent, that's the key. It unlocks sharing, but only for the provider you choose, for the records you choose, and just for that specific time you've agreed to.
Okay. Now, there's always a big question that pops up with digital data, especially sensitive stuff like health records. What about government access? Can the government just, look into my ABHA linked records whenever it wants?
Right. That's a very common concern. The information available states quite clearly, no. The government will not have direct access to your individual identifiable health data without your consent. Your records, they're processed and stored securely, but at the healthcare facilities themselves, where you got the treatment. They aren't sitting in some massive central government database that's easily accessible.
Okay, so my personal records are protected by needing my consent. But what about using data more broadly? For public health research, planning services, that kind of thing. How does ABHA fit with that?
That's a really important distinction. There is potential for using health data in the future for those broader public health goals. Things like tracking disease trends, developing better policies, improving healthcare for everyone. But, this is key, that would involve anonymized and aggregated data only. Data where all personal identifiers, anything that could link back to you, have been completely removed.
Anonymized. Got it.
Yeah, and the understanding is that the rules, the protocols for how even that anonymized data could be used, those would only be set up after a lot of public discussion, consultation, proper processes.
Yeah.
And importantly, in the meantime, your individual identifiable health records won't be used by the government for these wider purposes.
So really, the core message here, the bottom line, is that for my own health journal, my specific records, I'm the one calling the shots on who sees what and when.
Precisely. You remain in control. And to help make that control easier for you to manage, there are tools like the ABHA mobile app. These let you see which records are linked, check who's asked for access, and manage your consent easily. Grant it, revoke it. It really aims to put that power directly into your hands.
Okay, so let's just really summarize this then. Your ABHA number connects your digital health records, yes. But, and it's a big, but doctors and hospitals can't just access them automatically. Your explicit permission is absolutely required. It's the gatekeeper. And you even have that fine-grained, that granular control over which specific records get shared for any given interaction.
That captures it perfectly. The whole framework, it's trying to strike that balance. On one hand, you get the real benefits of digital health information, potentially better diagnoses, smoother care between different doctors, less reliance on paper. But on the other hand, it's designed to strongly protect your fundamental right to privacy, your autonomy over your own sensitive information. That consent mechanism is absolutely central to upholding that.
It certainly gives us a lot to think about, doesn't it? As technology gets woven more and more into our healthcare, how do we as individuals keep navigating that line, the line between the convenience and benefits of these connected systems and, well, our fundamental rights to privacy and control over our own personal data? It's a question that probably isn't going away anytime soon.